How many fingers?
4.
Good. How many now?
2.
Good. Just keep looking at me for a minute. You're going to shine my light in your eyes. Great. Stay with me. Good. Now watch the light. And just follow it as it moves. Up and down and up. Very good. Look at me again. Show me a big smile. Good. Stick your tongue out. Very good. Shrug your shoulders up. Great. Good. Now I'm going to whisper a number in your ear. You just tell me the number.
6.
Very good.
4.
Very good. Arms out in front. Palms to the ceiling. Close your eyes, please. Good. You can open your eyes. Give me a hard squeeze. Really good. All right. Great. Arms up. Don't let me pull you down. Be strong. Good. Strong on this side. Good. Now push me away. Good. Push me away. Very good. Nice and relaxed for a minute. Real loose. Great. Real loose. Good. Take this hand and tap very fast. Good. The other one. Very fast. Good. Take that finger and touch your nose, and then touch my finger. Go back and forth and back and forth. Good. With the other hand, do the same. Very good. Excellent. All right. Now hold on to the stretcher. Hike your knee up to my hand. Keep it up. Strong. Good. Fingers up. Be strong. Good. All right. Okay, push me away. Great. Push me away. Very good. Bring your foot up. Hop your toes up toward your head. Don't let me push you down. Be strong. Very good. On the other side. Strong. Hold them up. Very good. All right. Now, so what I'm going to want to do is I'm going to hold your foot up. I want you to put your heel on your knee and then make a straight line down your shin. Very good. Excellent. Do the same thing with the up. Great. Now, I have to scratch the bottom of your foot. It's annoying. Sorry.
That is.
All right. There you go. Okay, very good. Now, I just want to see how you feel things. All right. Okay. So I have a piece of cotton here. And I'm going to take that piece of cotton and just tell me, are they about the same? Roughly the same?
The
good.
Same.
About here and here? Roughly the same?
Same.
Here, here, and here. Roughly the same? Now, this will be a little bit sharp.
Okay.
Is that sharp? Roughly
sharp,
the same?
yes.
Good. Here?
The
roughly
same.
the same? Here? Roughly the same? Very good. I have a tuning fork. Makes vibration. Buzz. And buzz. About the same.
Same.
Good. And here. And here. Roughly the same?
The same.
Good. I'm going to touch your right hand, your left hand, or both. You just tell me what.
Okay.
Eyes closed. What I touch.
Both.
Good. Very good. You can open your eyes. I'm going to just tap you here. I want you to be nice and relaxed. Okay. Good. Nice and relaxed. That's great. Just like you're doing. Perfect. Nice and relaxed. Good.
I'm just going to look a little bit closer to here to see if you have any swelling. And I don't see any. Okay, good. We're going to bend your leg here. Does this bother you at all?
No.
Okay, good. How about this here?
It's okay.
Good. And then just rest your heel on the table there. I'm going to push in some different spots. You let me know if I hit anything that's sore. Any of that bother you?
No.
Okay, now I'm going to push over here. Good. Up here?
Yeah, it's okay.
Okay, one last spot. Kind of right in here. Anything there?
No.
Okay, good. All right, we're going to move your leg around. Just relax it. Does that bother you?
No.
Good. Good. And then just relax your leg. Relax. Good. Very good. Okay. I'm going to let your leg just kind of hang off the table here.
Okay.
Does that bother you?
Yeah.
Good. How about that?
It's okay.
Okay. All right. We're going to twist it around, and again, let me know if any of this is bothersome. Anything there? Okay, we're going to do it one more time. Good. Okay, very good. If I push under here, does this bother you at all?
No.
How about this side?
Yep.
Okay. Flex this muscle up for me and relax it. Good, and flex it up again. Very good. Okay. One last spot here. As I bend your knee there where I'm pushing with my thumb, does that hurt?
No.
Okay, good.
Fold your arms, please, ma'am, and stand up. Very good. That's equivalent to half of a deep knee bend, so you've got a 5/5 quadricep strength right there. While she's up, I'll say stand on your toes, please. Good. Stand on your heels, please. Good. And let's pat real fast. And let's pat real fast over here. Very good. And can you walk heel touching toe for me? Good. Okay. All right. And put your feet together. Close your eyes. Don't move. Very good. Okay. Let's have a seat on the table. So I've basically checked a Romberg. I've checked lower extremity strength. I've already checked for coordination and spasticity in the lower extremities. I've done everything to combine as many things while I'm down, while I'm moving, and now I'll do the part of the exam while we're seated. And we'll start with cranial nerves. And of course, you remember cranial nerve 1 is smelling. She covers one nostril, and we hold something like orange extract or coffee. We check each nostril individually. As a rule, unless there's some problem with smell or taste, it's not even done. Hence, on your exam, you write cranial nerves 2 through 12. Never write 1 through 12 if you didn't do it. If ever a legal issue comes up and you didn't document you checked smell, your validity's already gone, and the lawyer will just point out, well, doctor, if you'll admit that, how much else did you omit or fake in the progress note in the examination? Okay, cranial nerve 2, we're going to go vision, and we do it monocularly, all 4 quadrants. Okay, look at my eye. We see the same thing. Look at my eye. How many fingers? Good. How many? Okay, how many? And how many? Good. And now this eye. All 4 quadrants again. Okay, and it's best to use 1 or 2. 3 and 4 gets too complicated. Now, checking the extraocular muscles. It's the easiest, fastest way to do it. Follow my finger with your eyes. Just make a big G, and then come in. Good. All right. And while we're checking the face, wrinkle your forehead up, and we have nice creases bilaterally. Show me all your teeth. You're looking at the depth of the nasolabial fold and symmetry on both sides. Puff them full of air. Again, looking for any facial weakness there. Stick your tongue out. Wiggle. Okay. Open wide. Say ah. Good. Okay. Close your eyes and point to the noise you hear. And she has excellent hearing. Okay. All right. What I want you to do is to push my hand away. Turn your head. There you go. Okay. Turn your head this way. Very good. Look down. Good. Now bend down and look up. Very good. All right. And then while we're going, we're just going basically head to toe. So let's skip to the shoulders. Hold your arms up like this. And we'll go ahead and do motor of the deltoids. Good. Make a muscle. Pull back. Good. Pull back. Good. While I'm here, push away. Triceps. Push away. C7 triceps. Good. Spread your fingers apart. Don't let me push them together. C7, C8. Good. Thumb to index finger. Don't let me pull them apart. A lot easier to check weak muscles than strong muscles. Thumb to little finger. Don't let me pull them apart. And you got to remember, it'll be a lot different between a 20-year-old and an 80 or 90-year-old. Okay, let's do this. Tap, tap, tap. And now this side. And remember, our dominant hand will be certainly a lot smoother than sometimes a little klutzy on our non-dominant hand. 1, 2, 3, 4, 4, 3, 2, 1. 1, 2, 3, 4, 1, 2. Okay, good. All right. Clap up and over, up and over. And this side. Some physicians will have them do it on their thigh, up and over, up and over. And now the other side, up and over, up and over. Whatever you're comfortable with and is easiest for you and the patient. Okay, the old standby in neurology, pronator drift, close your eyes, don't let them move. While you're checking pronator drift, you might as well knock out cerebellar testing while you're there too. I do check and rebound. She checks the downward movement, it comes back without excessive flailing, so that's good. We'll look for pass pointing in the cerebellum, make a pointer. Go ahead and feel the tip of your nose, see where it's at. Most people will miss it the first time, so go ahead and know where it's at. Now touch the tip of your nose. Good, come on back. Touch the tip of your nose, come on back. And this is interesting, most people don't know this, but you feel my finger? Okay. I want you to touch your nose and then come back to my finger without looking. Touch your, okay, feel my finger, touch your nose, come back to my finger. Okay, that's very close, skimmed on the side of it, okay? Now, while we're here, we'll just go ahead and start knocking out our reflexes. Let your jaw just fall and relax. Jaw jerk, that's checking a reflex at the level of the palms. I'm going to drop down. Get the biceps, C5-6. While I'm here, I'm going to get the triceps. Let it fall. Just relax, just relax, just relax. C7. I'm going to get brachioradialis. Again, getting a C5-6. What I can do is come on down here. I'll watch the move of her thumb. And you're really dropping to get C7, 8. Another way of testing it would be watch the movement of the thumb when I flip her finger. And of course, if there's any signs of hyperreflexia, the thumb really jerks excessively when I do that. Okay? And then you're sort of in, as far as reflexes go, no man's land. Of course, you can do abdominal reflexes, checking the upper and lower thoracic levels. The anal wink checks S1. Other than that, you're in no man's land until you get down to the knee, L2, 3, 4. So we come down, we check L2, 3, 4. Okay, if you ever get some asymmetry, put your hands together and pull. Pull. Okay, called the Gendrasic maneuver, just distracting, and pull. If you ever can't get an ankle jerk, do this. Push down against my hand like you want to go 1 mile an hour in the car. And all you're essentially doing is making them relax, because they tend to help you. When you want to lift the foot up, they tend to hold their foot up. When they hold their foot up, you don't get an ankle jerk. Okay, push down 1 mile an hour. And 1 mile an hour here. Good. And while you're here, go ahead and do plantar responses. Again, lateral aspect of the foot, coming forward, crossing over at the base of the toes. And no response is certainly normal. You might write that on the chart as not a downgoing toe, but a silent toe. The main thing is she didn't fan and go up with a Babinski. Okay, so we've done that. And the least favorite part of everybody's exam is sensory. And the cotton tip applicator is your primary weapon here, if you can get it to splinter. So again, we'll just drop up and start head to toe. Okay? Sharp, sharp, side to side comparison. So you did the 3 divisions of the 5th cranial nerve. Sharp, all the way around, same side to side. Same side to side. And you may want to go to the hands. You got to remember too, if you got a peripheral lesion such as an ulnar entrapment or a median entrapment carpal tunnel, it may be different one side to the other. So just because there's a difference doesn't mean that you've had a stroke or some type of upper motor neuron lesion. Ideally, the patient would be in shorts or in a gown, so you can just go all the way around the thighs, front and back, all the way around, and make sure it's the same on either side and same left to right. And again, down here, you can do the same at the calf. Go all the way around and compare that side to this side. And on the foot, all the way across. It doesn't necessarily mean something serious. Neurological could be an old disc lesion that they're no longer aware of. But as you come across, you go into your upper lumbar segments and rule that out. All right, checking, you can double check pinprick pain with cold. So cold should be the same on both sides. If there's diminished pinprick on one side, there should also be diminished cold. And diminished cold is the tuning fork feels warmer, not colder. So this is the same on both sides. While we're here, feel it buzzing, checking the posterior columns. Tell me when it stops. And tell me when it stops. And again, remember too, if there's diminished vibration, this person usually has problems with proprioception and balance. It could be as simple as a peripheral neuropathy with diabetes, hypertension, long-term smoking, or keep in mind the two primary diseases of the posterior columns, B12 deficiency and syphilis. Okay, and you feel this buzzing, and tell me when it stops. And feel this buzzing, and you don't have all day, so speed up stopping by just gently touching it with your hand.
Stop.
Okay. While I'm here, cold. Is it the same all the way?